Good day, ladies and gentlemen. This is Fruhan Landman from Key Wealth. And in this video, we're going to have a quick overview and have a look at the Beat 3 option for Bestmed for 2023. So let's dive in. Firstly, just take note that you've got a network option, which has a reduced premium of 3,128 Rand for principal member. And you've got a non-network option, meaning you can go to any hospital for 3,400 Rand per month for principal member. With Bestmed, you only pay for 3 children, so the 4th one is on the house, and they stay child dependents up to the age of 24 and 26 if they are studying towards a registered qualification at a recognized tertiary institution. So the Beat 3 option has some scheme benefits or risk benefits and some savings benefits. So let's dive into those. Firstly, your in-hospital benefits, which is the most important thing that you buy when purchasing a medical aid, is that you've got your accommodation set at 100% scheme rate, so that's fine. You've got your 7 days take-home medicine, this benefit over here. Just take note that this medicine has to be collected from the hospital's pharmacy, not a pharmacy at a hospital, but the actual pharmacy within the hospital. In other words, where the hospital gets their own medicine. They cover biological drugs during hospitalization up to the set amount. They do have cover for mental health, chemical and substance abuse, and then your consultations and surgical procedures covered at 100%. Just take note that these 100% on service charges or specialist or doctor's rates would be if you go in for a procedure and say to remove your appendix, the doctor charges 6,000 Rand, or the scheme rate rather is 6,000 Rand. That's 100%. The doctor can charge anything above that depending on how complicated the procedure is, how specialized he is, the time of day, etc. So say if he charges you 12,000 Rand for the procedure, this would be 200%. You would be liable for the difference between the 6,000 and the 12,000. And that is where a gap cover comes in. So make sure that you've got a gap cover. You can reach out to us at any time and have a chat with us regarding gap cover benefits. So most of your major things in hospital is covered. So you've got maxillofacial surgery up to a set amount, in hospital dental and oral surgery up to a set amount. You've got prosthetics that's covered up to a set amount. Just take note here that there are changes from 2022 to 2023. They have now included spinal artificial discs. So that's a new benefit for Bestmed. And then just take note that external prosthesis is an exclusion, or there's no benefit, or will be covered in PMB events only. And the same applies for major joint replacements. In other words, the full and total replacement of a hip, a knee, or any other minor joints. Your pathology, which your blood tests, covered at 100% rate. Basic radiology, which is your x-rays, covered at 100%. Your specialized diagnostic imaging, MRI and CT scans, is covered at 100%. Oncology is an interesting benefit with Bestmed, so they will cover 100% of the cost if it's an approved treatment plan. If your plan does not get approved on Beat 3, you can upgrade to a higher option within 30 days. So that's an excellent benefit with Bestmed. And then many of your other benefits, I'm not going to go into all of them. Confinements covered at 100%. That's basically if you're pregnant and you're giving birth. There's midwife assisted births, which is very nice. And then also you've got palliative care and certain day procedures that you can do at a hospital facility. Just note that there are designated service providers for these, and if you don't go to the right hospital or use a non-DSP specialist, there will be a co-payment of 2,500 Rand, but this we can again claim back from a gap cover if you have the correct cover in place. You do have international travel cover, so just make sure that it's ready for you to go before you leave, and just take note of the different amounts that's available and the different time periods depending on the countries. So co-payment with Bestmed Beat 3 is if you're on the network option and you go to the wrong hospital, there's a 13,078 Rand co-payment for the voluntary use of a non-network hospital. This again can be claimed back, the majority of it, from a gap cover, so make sure that is in place. Your out-of-hospital benefits, your family practitioner, GPs and specialists will come from your savings account. There's a diabetic primary care consultation that you've got access to at a Dis-Chem pharmacy. You've got your basic and specialized dentistry, which would be from your savings account. You do have some preventative dentistry benefits, which I'll discuss in a moment. Medical apparatus savings account, hearing aids savings account. Most of it, you've got a benefit for wound care, so that's after a major operation to clean the wound, etc. You've got 12,000 Rand for diagnostic imaging, specialized diagnostic imaging. Just take note, it does not include your PET scans. I'm going to make a note over here, should you go for a scan, and let's take an example here, the scan is 10,000 Rand, okay, your MRI scan. Bestmed will pay that in full, so that's fine, and now you've got 2,361 Rand left. If you've got to go for another scan at 10,000 Rand, the 7,639 Rand shortfall that you'll have because your benefit has been depleted will be covered from your gap cover once. All right, so again, important to have a gap cover in place. If you go for a third scan, there's no payment, no benefit from Bestmed, meaning no payment from your gap cover. So very important to take note of that. Oncology, we've discussed, so that's great. And next up, we have your medicines. So your acute medicine, that's prescriptions, is from your savings account. The same with over-the-counter, that's your schedule up to Schedule 2. Biological medicine is as per funding protocol, but PMBs only. In most scenarios, this will be covered on the higher plans. That's a benefit that's included there. So if you do need this, as an example, is something like Herceptin for breast cancer, you would most likely have to upgrade your plan to get those benefits. Then there's an additional benefit of 3,793 if you're one person, one or more, 7,716 Rand for non-CDL chronic medicine. I'll go to the formulary just now. Just take note that there is they cover it at 80% of scheme rate, so you'll always have a 20% co-payment. And then if it's not a formulary medicine, there's also a 30% co-payment there. Chronic medicine is always difficult. The reason for that is that pharmacies can charge dispensing fees because it's a non-CDL. They only cover 80%. If it's not on the formulary, there's a 30% co-payment, and that co-payment is based on the amount that the medicine will cost on the formulary. So if the amount on the formulary is 100 Rand and you're drinking medicine of 500 Rand, the difference of 400 Rand can still come out of your pocket as well. So very, very complicated procedure to work out exactly what they will pay for the medicine, depending on the type of medication you receive. But if you need any help with that, you can reach out to us. They then also have the normal chronic CDL and PMB medication. So the normal chronic conditions are covered, your asthma, bipolar, things like diabetes, epilepsy, high blood pressure, high cholesterol, etc. And then they also cover severe acne, some allergies, eczema, migraine, and ADHD. So this is a great benefit. If you have children with ADD or ADHD, it's a very affordable option, and they do cover those medicines. So very, very nice. And then they also cover all of these PMB conditions as chronic. So that's also great. You can just pause the video here if you want to have a look at it. And then you've got your preventative care benefits. So flu vaccines for everybody, pneumonia vaccines. If you're in a high risk group, you get your travel vaccines, pediatric immunizations. This is a great benefit. There are some of them that are very, very expensive. They also pay for the female oral contraceptives, up to 2,500 Rand per year. So great benefit. Just take note that your amount can run out. So if you're using something at 255 Rand per month, you'll basically have 10 prescriptions that you can get, and you'll pay for, say, November and December out of pocket or savings. You've got a back and neck treatment plan, so that's very nice. HPV vaccinations for the ladies, also a great benefit. They've got mammograms, preventative dentistry, PSA screening for the men, and pap smears as well. Just take note of the age restrictions on these and that you're in that, and then also the frequency that you can get it. Just know that many of these, so take a PSA screening as an example, you can go to your GP, a clinic, a urologist, it doesn't matter, but that will be paid from your savings account. Same with the pap smear savings account. The actual pathology test is what Bestmed will cover. So just make sure that you are covered for, or that you understand the cover that you've got. Then with your Tempo Wellness, as soon as you've done your health assessment, you unlock this benefit where you get a fitness consultation with a biokineticist and a nutritional consultation with a dietitian. So you can reach out to us to make sure how to do this and how to utilize that benefit. You also have 9 antenatal consultations and 1 postnatal consultation for pregnancy or maternity benefits, 2 2D ultrasounds, and then also some supplements, which is very nice when you're pregnant. The last thing to discuss is the preventative dentistry. So if you are under 12, you can go twice a year for a consultation and a full mouth examination, or once a year if you are over 12. You've got your full mouth intraoral radiographs once every 3 years, 2 photos a year for intraoral radiographs. You've got your scaling and polishing twice a year, fluoride treatment twice a year. Your visual sealing and space maintainers is included in this benefit as well. So stunning benefit. And lots of value. Please note that if they do any extractions or any fillings or anything like that, it would be from your savings account or your own pocket. On the day-to-day benefits, if you are on Beat 3 for 2022, just something to take into consideration is that they have removed, there's no mention of it in the brochure, but they have removed the benefit for glasses. So no more optical benefits on this plan. And make sure that if you do use that benefit or wear glasses, that you are on the correct plan for 2023. We do have links in the description below where you can click to get a quotation or to book a meeting with one of our advisors so that we can help you to get the best cover for 2023. Have a great day.